students, welcome to this video tutorial. In today's session, we are going to discuss vitals. Of course, vital signs. So basically these are called vital signs because they represent many systems of the body. Looking at the cardiovascular system, the respiratory system, as well as the brain itself. Okay. So now, under the vital signs, we are going to look at we are going to define each vital sign and some of the specific parameters that we are going to focus on is what are some of the indications. Let's look at the general indications for each and every vital sign, and then we're going to look at some of the indications for individual vital sign, and then you must be able to detect the abnormalities in these vital signs. You should know whether it is low or whether it is high. That's what I mean. Then apart from that, you should know where exactly to get these vital signs. Okay, where there are steps involved in you obtaining vital signs. Of course, it's also very much important that you take note of that. Some of the processes that you must incorporate for you to accurately get these signs. Okay, now let's get started. Of course, in these notes, I have written a lot of information, but of course, I'm only going to concentrate on those much important areas. Later on, I'm going to send these notes in your group, then you can actually pass through at your free time. But for now, let me highlight on the most cardinal parts for vital signs. Okay, so we must be able to know that vital signs are cardinal measures of various physiological statistics taken to assess the most basic body functions. Okay, so basically, like I said, these vital signs are there to assess of course most basic body functions, and most important, of course, looking at the cardiovascular system as well as the respiratory system. Okay, so these vital signs actually help to evaluate the progress of patient's condition. Okay, they can tell you whether the patient is progressing well or maybe the patient is not doing fine with the treatment. Therefore, these vital signs should be taken at consistent intervals while the client is at rest. So it's very much important that you take vital signs when the patient is at rest. Why? Because there are a lot of factors that changes the vital sign of a person. You can't expect blood pressure of someone who is from running to be the same when someone is just resting. Okay? Same with the respiration of someone who is from running and then someone who is resting. So therefore, make sure that these vital signs, you confirm their abnormality or validity after asking if the patient have been involved in any extraneous activities, anything that required them to apply effort. So it's very much important. That is just to help you in monitoring the accurate or valid health progression. Okay. So now, apart from other things, vital signs are also taken in patients who have critical conditions. Okay, this is just to also assess whether they are improving or the things are getting worse. Okay, so now in cases where you find that okay, let's say you find abnormal findings for vital signs, you don't need to have to conclude right there and there. Okay, you need to verify the findings. So for example, if you measure that the BP of someone, maybe you've measured the first measurement you did, you got higher blood pressure, and then you thought maybe it was kind of machinery error, and then you try again, then it gives you the same. Don't conclude or don't rush into conclusion. Of course, intervene in the most possible way that you can try to intervene at that particular time. But don't jump into conclusion that someone is having hypertension, which is high blood pressure. No, you need to verify, measure later on. Okay? So of course, these vital signs we're talking about, we have temperature, we have pulse, we have respirations, and we have the blood pressure. These are very much important parameters. Now, what are some of the indications for getting vitals? When do we get the vital of the patient? Okay, so one of them is that on a client's visit to the health facility. Okay, once the client visits the health facility, a lot of you have gone to in fact, every one of you have gone to the health facility. The first thing that they did before they could even ask you of anything is they got the vital sign, of course. Okay, most important thing I'm talking about. This is the first health intervention that they're going to do. They'll get the vital sign. Even if someone is in a critical condition, they also want to get, they'll be intervening, others are getting the vital signs. Because vital signs, remember I said, they also monitor the progress of the of patient's condition. Then the second one is, it is done as a routine on admitted patients. So this is done every day. Okay, every day. On every day it can also be further divided. Those who are most critical can even be taking half hourly, 2 hours, 3 hours. Okay, those who are admitted. So it just depends on the condition of the patient. Then it is also done when assessing the client during home visits. When you are assessing the client during home visit, you need to take vital signs. Okay, vital signs prevent assumptions. You don't need to make assumptions of someone's health. No, I found them breathing, I found them resting. In these instances where you you assumed that the patient was fine, and then you had seen them, then just maybe minutes later, then they find themselves in a critical condition. Okay, you might be responsible for that. So you don't need to assume the patient's healthy. Okay, so healthy is not just a minor thing, looking at someone that they are able to speak. No, you need to look at all parameters. According to World Health Organization, you need to look at all parameters: mental, physical, well-being, etc., etc. Then when else is before and after the administration of medicine or therapy that affect cardiovascular, respiration, and temperature control functions. So there are some medications. Okay, there are some medication that affects the vital signs of the patient. Let's say we are talking about maybe the patient is having high blood pressure, right? And then you administer any antihypertensive drug. Let's say the patient was in a severe state of hypertension, and then you gave them hydralazine. And then hydralazine, one of the side effects of hydralazine is that the patient can have now hypotension, which is low blood pressure. Therefore, you need to monitor if the effect of hydralazine has not exceeded the therapeutic effect. Okay. Then apart from that, when the client's general physical condition changes before, after, and during nursing intervention, influencing vital signs. So in case the general condition is changing, like you are nursing the patient in the ward, and then you look at the patient, all of a sudden they are restless, they are breathing fast, so you can actually take vitals. Then when client reports symptoms of physical distress when clients report symptoms of physical distress, okay, so some kind of physical distress can come due to maybe cardiovascular, even respiratory issues. So you need to take vitals to confirm. Then before and after a surgical invasive diagnostic procedure, this is done by nurses each and every day for the patient who are actually going for theater. You need to make sure that you measure the vital signs to ensure that, in as much as you are sending the patient to theater, they are in a condition that can withstand maybe blood loss, any trauma that is going to be closed. Okay, and after the theater, you just want to confirm that the patient that you are going with to the ward is again in a stable condition. Okay, so now let's start looking at each vital sign one by one. We have body temperature. Of course, there are some things that we are going to discuss, like abnormalities, how to get it, how to prepare the patient for it, okay, how to intervene in case of abnormality. So the body temperature. So of course, the normal body temperature balance between the heat produced is the balance between the heat produced and the heat loss. So the body temperature, for it to be at a normal ranges, it needs the two parameters to be at equilibrium. They need to balance. Okay, so at this balance, we mean the heat that is produced should balance with heat loss. When you lose a lot of heat, your body should also produce a lot of heat to cover it up. And like if there is imbalance where heat loss is too much as compared to heat production, then they come imbalance. Of course, the imbalance we're talking about is either you have low or high. Okay, so now temperature can be taken in two units. It's one is the Fahrenheit and then the other one is the Celsius. Of course, they also call it the centigrade. Yeah. Okay, so the normal range temperature in both degrees and Celsius. For degrees, it is about 36.2 to 37.4 degrees. You should take note of this. This is the normal range. And then, if you convert this temperature to Fahrenheit, you find that it is 97 to 99 degrees Fahrenheit. So this is the normal temperature. Now that you know the normal temperature, meaning that even when you are taking vitals, you'll be able to interpret it. Got it, right? Of course. So of course, there are some of the terms associated with the temperature. We are just going to pass fast and concentrate to other areas where we have more of interest. So you find we have thermolysis, which is also known as, which is just the regulation of loss of heat or physical heat regulation. Thermogenesis, look at the regulation of heat production or chemical heat regulation. And then you also find terms like heat. This is just thermal energy taken up or given out by the body or being transferred from one body to another. Some of the terms in case you meet them. Okay, this is what we call basal body temperature. This is the lowest temperature attained by the body during rest, usually during sleep. So it is usually generally measured immediately after awakening or before any physical activity. This is the basal body temperature. So in case you meet these terms, just know that it's that. Okay. There's also what we call core temperature, also called core body temperature. This is just operating temperature of an organ, specifically in the deep structure of the body, such as the liver, in comparison to the temperature of the peripheral tissue. So we are talking about those internal organs, okay, and the temperature of those operating organs, like the liver specifically. Looking at its temperature as compared to temperatures of peripheral tissues. The peripheral tissues are talking about external organs mainly. Okay. So of course, you also need, it's very much important also to talk about the thermal regulation. It's just a hemostatic mechanism that keeps the organism at optimal operating temperature. Okay. So now this thermal regulation, look at factors like heat production as well as heat loss. Okay, so thermoregulation is just looking at the fact that the body regulates what is lost and what is being gained. So heat production is from metabolism of nutrients, skeletal muscle activity, vasoconstriction, clothing, especially dark color, and warm clothes. This is how heat is produced. And heat loss is achieved by exposure to cold environments. You also find body excretion, vasodilatation, which is enlargement of the blood vessels, and respiration. So these two are very much important that you know them: heat loss and heat production. Because even how you are going to help the patient is through this mechanism. Okay, so if they are not eating enough, you encourage them in case of metabolism, skeletal muscular activity due to movement and other things. Vasoconstriction, when a blood vessel reduces its lumen. Okay, when blood vessel reduces its lumen, it increases the blood pressure. Once blood pressure increases, blood distribution to all parts of the body increases. And you know, one of the functions of the blood is that it is there for regulation of body temperature. It more like distribute the temperature across the body. Okay, so those were things. Then you also find that there are processes of heat loss like conduction, radiation, convection, evaporation. These are same things, simple things. Conduction is just heat loss due to contact, where maybe you are in contact with the hot substance or cold substance. Then radiation, this is just transfer of heat via the air. Okay, let's say in cases where someone is receiving heat from the brazier, that is via radiation. Then convection, this is now the heat is carried away by air current that passes over the body. Now convection happens maybe due to you've taken some warm water, or that. And evaporation is just loss of heat via the skin, maybe through sweating. But of course, let's look at the types of the thermometers that are used when taking this temperature. Okay, and in summary of what we have looked at so far, we have described the vital signs in the introduction. Then we went to indications when you get vital signs, and then we looked at all the 4 vital signs, and now we've started describing one by one. Temperature, we looked at the normal temperature. We also looked at in which units is it measured in, and then we looked at how is temperature lost and how is temperature gained. And then we looked at some terminologies that can be used in temperature. We also looked at thermoregulation, which was looking at the body loss and the temperature loss and temperature gain. And then we went to look at types of thermometer, because you should know the thermometers that are going to. How do you measure this same temperature? These are types of thermometers. Thermometer is an instrument that is used to measure the temperature. So we have what we call clinical or mercury thermometer. The clinical thermometer may be oral or rectal. It can be put in the mouth, or it can be put at anus. Okay, so this is how it looks, the clinical thermometer or mercury thermometer. Press in the mouth, and then you wait for 3 to 5 minutes. Then it rings. Then you get it and get the readings. Okay, so we have all of them in Fahrenheit, and then we also have the one in Celsius. Then we also have what we call electronic. This is a portable, and it operates by a battery. So it registers the temperature in 10 seconds or less and displays it digital. So this one, you've seen this kind of thermometer in the hospital, where you put in the patient axillary, the armpit, and then you get the temperature. It records within 10 seconds or less. Okay. Then we have also what we call infrared. So the infrared, it gets temperature from a portion of the thermal radiation, sometimes called black body radiation, emitted by object being measured. That's why you see it being pressed on the forehead. This one is it runs at the frequencies. Okay, it detects the temperature that the body is emitting. That's why you can get it from the patient of forehead, and then it records, because the world is actually evolving. So now, what are some of the sites? We've looked at thermometer, we've looked at the electronic, we've looked at the clinical mercury, as well as the infrared. Okay, the most common one you find maybe in UTH, you find the electronic as well as the infrared. Okay, so now where do you get this same temperature? It's very much important that you know where to get this same temperature. So we have the axle. So used when temperature cannot be taken by mouth. If temperature cannot be taken by mouth, and not only that, maybe in case you just don't have the mercury thermometer, which can be taken, which is usually taken from the mouth or the rectal, then you can use the electronic to get from the axle, which is just by the armpits. It is convenient and hygienic because every time it is made aseptically clean with the spirited swabs or alcohol-based swabs, then you put in another patient's armpit. So it is left in the armpit for 3 to 5 minutes and then it gets the temperature. Then we also have groin. So yes, it can be used in infants, although it might be less accurate as compared to the axial temperature. Okay, so it is left in the groin for 3 to 6 minutes. So you should take note that in case the patient is having, so usually it is used in infants. So in case where the infant is having some kind of wound or inflammation, you should take note that it cannot be used when someone is having wound or kind of inflammation. Then there are also mouths, which is oral temperature. Okay, so it can be taken after 3 minutes of keeping a thermometer in the mouth under the patient's tongue. You just press it under the patient's tongue. Okay, so for this one, usually it happens, it's good in a case where the patient is having the thermometer is specifically for one person. Okay, so you should also take note that the patient does not eat anything 15 minutes before checking the what, the temperature. Okay, so now when do you not get temperature? When do you not get temperature? The oral temperature specifically, when do you not get it? That's what we mean contraindicated. So you should not get temperature, oral temperature in the unconscious patients, children and irrational patients, nose and mouth surgery, or in case of mouth ulcers, you should not get this temperature. Okay, then there's also rectal temperature, which is taken in babies and very ill patients. Okay, so now looking at what are some of the factors that affect normal temperature. So looking at the factors that affect normal temperature will help you to intervene in a better way. Okay, or interpret results with better understanding. So what are some of the factors that affect body temperature? We have time of the day. Late afternoon or evening temperature rise due to the increased activity of the day, and it will be reduced at night due to reduced activity. Remember we said one of the ways the body temperature is produced is through the muscle activity. But muscle activity usually comes when you are involving yourself in extraneous kind of work, where there's manual work, you are doing some kind of what, people will sweat. That's why late afternoon or evening temperature rises. Okay, then we also have age. Infants and young children have a slight raised temperature due to activities, and there are also insufficient ability to regulate heat in their bodies. So the infants and the young children, temperatures are usually raised. Okay, one of the factors is that they lack a better mechanism, the thermoregulatory mechanism. That's the reason why these young children should be kept warm at all times. Because when they lose the heat, for them to gain heat, it's hard again. Okay. Then we also have exercise. So the body usually will lose heat during exercise. Okay. Will lose heat during exercise through sweating. That happens evaporation on the skin. On the menstrual cycle, So variations in temperatures are due to various phases. After ovulation, there is a rise in temperature, which is maintained until a day or two after menstrual has occurred. So all these are factors that affect temperature should be aware of. Even pregnancy, it also causes a slight change in temperature, especially when the woman is in their 3 to 4 months. Okay, and then it falls by 0 degrees Celsius until delivery occurs. So we should all look at all these factors that we have talked about. We've looked at the age, time of the day, exercise. We've also looked at the menstruation or menstrual cycle. Okay, so these are some of the factors. Of course, there are more related factors, but in today's session, we are going to other things. Of course, you also find some terms that are related to body temperature, like hypothermia, reduced body temperature below 36 degrees Celsius. This is a hypothermia, low temperature. Okay, it's low temperature. Then you also look at causes of hypothermia. They are simple. Prolonged exposure to cold, reduced metabolism, heavy sedation, etc. Okay, so now let's look at another term, which is the fever or pyrexia. So fever or pyrexia refers to temperature above normal range. So they can ask you these terms: what is the pyrexia or what is fever? So temperature above normal range. Then when you look at hypothermia, it is just a rise in the temperature above 40 degrees Celsius. It is also called hyperpyrexia. So you should know these things. They can bring ranges like maybe a rise in temperature of about 40.6 degrees Celsius is cold. Then they bring options like that. Of course, I told you that there are a lot of notes in this that I've written, but I'm going to concentrate on those particular point of interest. So make sure that you don't mischarge me. You think I'm moving side. I just want to concentrate on those important areas, and then I'll send you notes. Okay. So you see, like causes of fever. So fever usually occurs due to disturbance to the hypothalamus affecting the heat regulation center, e.g. head injury, infections like malaria, severe dehydration, exposure to extreme heat or unknown. Okay. You also see signs and symptoms of fever. There is restlessness and delirium in adults, convulsions in children, headache and general body malaise, the feeling of being sick, evidence of body hotness when taking temperature. This is febrile to touch. You feel the temperature as you touch the patient. All these something about fever. Remember, I said I'm going to concentrate on important areas for you specifically. So we want to look at conversion of temperature. Conversion of temperature is done in this way. When we want to convert Fahrenheit to Celsius, we just subtract 32 from Fahrenheit and multiply that number by 5 and later on divide by 9. Okay? So for example, we have 98.6 degrees Fahrenheit. We just subtract 32 and it's going to give us 66.6. And then multiply by 5 is going to give us 333, and then divide by 9, and then it's going to give us 37 degrees. This is how we convert temperature from Fahrenheit to Celsius, which is degrees Celsius. Of course, you should also be conversant with how to convert this without a calculator. It is simple, just like this expression, and then multiply, and then division under. Then you can, once you start to follow body mass rule, and then you can come up with the answer. Of course, during exams they will give you exact figure, and I mean figure. Okay. And then if you want to convert Celsius to Fahrenheit, degrees Celsius you multiply by 9, then you divide by 5, you add a 32. So if you have a 37, the same 37 you found, you multiply by 9, which will give you a 33. Then you divide by 5, it's going to give you 6.6, and then you add 32. We have returned back to the same 98.6 we had. Okay, this is a simple way we convert temperature. Of course, we are not going to look at types of fever in this particular thing, but in case you want to look at them, I'll try to actually I'll send the notes. So we have this kind of fever. We have continuous, remittent fever, intermittent fever, inverse temperature, relapsing fever, the pale estrogen fever. All these are just simple. You can actually read them. Okay. And there are also some terms which are actually designated to fever. You find they have crisis and risis, sudden drop of temperature to normal within 24 hours. There's also a drop in pulse and respirations. Then also find risis, a gradual drop in body temperature. It takes 2 to 10 days. Okay. So now let's look at some of the procedure that you can do in a case of abnormalities in the temperature. Okay. Let's look at in case where someone is having high temperature. Okay. So there's what we call tepid sponging. What is tepid sponging? Tepid sponging is a procedure done by the nurse. What happens is that when the patient is having high temperature, let's do so we can say hyperpyrexia, which you are going to get lukewarm water that should not be hot and it should not be cold, lukewarm. And you are going to use a cloth and then you sponge the patient. You don't use cold water to reduce the temperature of the patient, lukewarm water. So this is a procedure carried out in order to reduce the temperature by 0.5 to 1 degree Celsius in cases of hyperpyrexia. Okay. Now that we've looked at temperature, let's look at another vital sign, because those are the most important thing that we can discuss on temperature. Okay. Let's look at pulse. Pulse. So pulse, what is pulse? Then we look at what are normal values of pulse, maybe in both adult and children. Then looking at how to get pulse, and then if possible there are some of the interventions. So pulse is the regular expansion of an artery caused by ejection of blood into the arterial system by the contractions of the heart. And that's how pulse is actually generated. So physiologically, when we look at the conduction system of the heart, we are looking at heart. There is what we call sinoatrial node in the heart. The sinoatrial node is also known as SA node, abbreviated as SA node. It's the one which is important for electrical activity, causing the heart to contract. And it actually causes the contractions of rate of about 60 to 100 beats. Okay, it's 60 to 100 beats per minute. Looking at the electrical system of the heart, the pacemaker cells, which are the SA node, they are the ones which are responsible for determining major factor in determining whether the pulse is abnormal or it's normal. Okay, so this SA node is the one responsible in looking at the activity or in controlling the activity of the what? Of the heart, in contraction of the heart, in order to bring about blood that is going to run in the artery. Okay, so left ventricles contract, causing a wave of blood to surge through arteries. The stronger the heart, the contractions of the heart, the higher the pulse specifically, because it's about the blood that is running into the arterial vessels. So it corresponds with each heartbeat, and it is felt by palpating a superficial artery lightly against underlying bone or muscle. Pulse rate is constant but varies with age and in the individual. So these are some factors that affects pulse. So what are some of the normal heart rates? The pulse. We have infants, which is about 120 to 160. Okay, 120 to 160 beats per minute. It's beats per minute. Toddlers is about 90 to 140. Preschoolers is about 80 to 110. School agers is about 75 to 100. The adolescents about 60 to 90. And then in adult, it's average 60 to 100. Okay, somewhere around average is around 72 somewhere. Then someone is considered normal. So now, when you look at the pulse of an infant, is about between 120 to 160. But for adult, it's 60 to 100. So you should know these both pulses, specifically for the infant as well as for the adult. This is going to be very much important for you to know the abnormalities. So what are some of the factors that affect the pulse rate? We have age. Remember just from describing the pulse rate for infants, about 120 to 160, but adult only 60 to 100, which is average 72. So age matters. Fitness and activity levels. Okay. Some people do not involve in physical activities. Okay, that can make the heart to pump fast to help with blood delivery into those tissues. Okay, emotions like stress and anxiety actually raises the student's pulse, specifically when doing assessment like OSC. Everything is not normal there, even temperature is. Okay, because students are stressing. Okay, and the stress hormones, once the stress hormones are produced, they start the process of what we call gluconeogenesis. Gluconeogenesis is about the production of energy, and the energy production comes with heat. That's why there is increase in heat, the temperature of the patient. The air temperature. When temperature and humidity rises, the heart pumps a little more blood, so pulse rate increases. So this is now very much important in maintaining a safe hospital environment. We discussed that the temperature and humidity should be controlled by opening nearby windows, even opening the air condition. When it's too cold, you open those central line heaters so that it produces heat. Okay, body position. So most of the time, what is body position? The way someone is positioned, okay, also affects. So in case of someone is in a standing position, so pulse may go up a little bit when standing for the first 15 to 20 seconds, but settles after a few minutes. Okay, then body size, pulse might be slightly higher than normal in obesity. Okay, then even some medication uses. There's some medication that blocks adrenaline, the beta blockers. These works in the central nervous system. They tend to slow the pulse, while too much thyroid medication or too high of a dosage will raise it. So now, there are important things that are very much cardinal on pulse. And what are these? When you are observing or taking pulse, you should take note of the rate, rhythm, tension, volume. Yes, these 4 parameters. So when you're looking at the rate, The rate is just the frequency at which the left ventricles contract to push blood into the artery. Okay? So when you're looking at the pulse rate, you want to see the number just. Okay? So the number that's going to show you 72. But of course, there is more to that rate. There is more to that than the rate itself. So there is what we call rhythm. What is the rhythm? It's the regularity or irregularity of the heart contraction. So rhythm is that pulse that you are getting continuously, or it's cutting, or it's not that regular. Because sometimes what we're talking about is it beating the same rate every per minute, or maybe there are some days it is faster in the first 2 minutes and it is faster it is slow in the next 4 minutes. That's what we are looking at the rhythm. So the rhythm, we're talking about the same rate throughout. And then there's also what we call elasticity or tension. So this is just the compressibility of the pulse on the artery. In use, the tension is less as compared to the elderly. So most of the time, because the elasticity of the young ones is actually better. It has a better skin tagger elasticity as compared to those, because the elderly ones loses the skin tagger. It loses its strength. So the elasticity we are just looking at, because this blood is pushing against the walls of an artery. So basically looking at, is it something that you can observe? Is the blood vessel accommodating this particular blood? Then we look at the amount now, which is volume. So this is the amount of blood distending an artery with each beat. Okay. So now the amount is, you can visibly see that this artery is actually transmitting a lot of blood per beat. So it's transmitting a lot of blood. You can look at the distension of the arteries and you can see that, oh, this person, you can observe that this person, the pulse is a little bit high. The volume can be less in shock, hemorrhage, and increased in exercise. So when it comes to shock, usually it depends on the type of shock. Most of the time, hypovolemic shock, that happens due to low volume in the body, or in case someone was bleeding, then blood volume reduces. So even the volume that is going to be traveling in the arteries is going to be reduced as compared to someone who is involved in exercise. That's why someone who's in exercise, you can see prominent veins. Most of the time, men are involved in exercise, in extraneous things, doing manual work, what. That's why you find that veins are actually more prominent. Okay, one of the factors. Then now, there are some terms that we should look when you're looking at pulse. These terms can be asked, so you need to be extra careful. There's what we call tachycardia. What is tachycardia? So tachycardia is just rapid pulse rate, usually above 120 beats per minute in an adult. Remember we said the normal one is 60 to 100, and then when it is above 120 beats per minute, this can happen due to emotion shock or maybe due to diseases. We call it tachycardia. Please take note of that. We also have what we call bradycardia. The pulse rate that is lower than normal can be due to drugs like morphine, hypothyroidism, brain tumors. When the pulse rate is lower than normal, we call it bradycardia. In adults where the minimum pulse can be 60, the maximum can be 100, and then you find that the pulse is actually below 60, somewhere 55, then that's bradycardia. What are some of the areas where you get the pulse? We have radial artery, we have the temporal artery, we have the carotid artery, we have the fascial artery, we have the bronchial artery, and we have the femoral artery. In case you don't know these areas, let me show you on this next slide picture so that you know where to get these ones. But most of the time, the The radial artery is at the wrist, is the most common convenient point for recording pulse. This one, you should take note. Okay. So most of the time people use the radial artery here, just here, and make sure that you don't use the big finger, because it has a pulse you might be measuring your own pulse. So use at least the fourth and third finger to measure actually that pulse. And these are all areas where you can get this pulse. Okay. For babies, usually we get the apical pulse. For infants, apical pulse, which is specifically on the heart. Okay, so now let's go into respirations. Those are some of the important things that can be asked on pulse. What are some of the respiration? Of course, you should know the process of respiration. Respiration involves breathing in and out of air. There's what we call expiration, which we call the passive process. It requires you expelling air out of the body. And then there's also what we call inspiration, which is an active process. It requires intake of air due to increased atmospheric pressure. When the atmospheric pressure exceeds the pressure that is in the abdomen, then air is going to be drawn inside. You should know those basic things. Okay, so what is respiration? So respiration is the exchange of oxygen and carbon dioxide between the atmosphere and the body cells. It consists of inspiration, expiration, and a pause. Inspiration, expiration, and a pause. During respiration, interchange of gases takes place in the lungs between air and circulating blood. That is the respiration. A lot of things happen during respiration. Carbon dioxide and oxygen are transported by blood in different forms, and carbon dioxide and oxygen is going to be used up once it reaches those cells that need oxygen. In case of cellular, what we call oxidative phosphorylation, where oxygen is going to be produced, okay, in the cells. Oxygen is going to be used in those areas. But after carbon dioxide now has been produced, it needs to get out of the body. That's what we're talking about, the interchange of gases. So what are normal respiration rate? Adults are 14 to 20 breaths per minute. You should be taking note of these. These are questions that usually come. Newborn, about 30 to 60 breaths per minute. So the ratio of respiration rate to pulse rate is 1 to 4. Okay. So the ratio of respiratory rate to pulse rate is about 1 to 4. So what does this mean? This means that the respiration rate is 4 times less than the pulse rate, or the pulse rate is 4 times more than the respiratory rate. So sometimes people use respiration to predict the pulse rate, or use the pulse rate to predict the respiration rate, but of course those are not accurate measures. You can divide the pulse rate by 4, it is going to give you the respiration rate, or you can use the respiration rate to multiply it by 4 and it can give you the pulse rate. But of course, just use the beta method of getting this. So changes in respiration occurs due to some of kind of fear, excitement, and exercise, or diseases. Breath changes from time to time. In case you are having fear, in case you are excited, things changes. Okay, so you should know these some of the changes apart from knowing the normal respiration rates. So we find also see some types of respiration like shallow respirations, common in the disease of the lungs, deep respiration, seen in acidosis. Acidosis is kind of when toxic acids are too much in blood. When toxic acids are too much in blood. And once toxic acid are too much in blood, they actually accumulate the product of carbon dioxide, because the red blood cells can no longer have the affinity for carrying the oxygen. Therefore, it is released. So at that particular moment, because oxygen is not evenly distributed, it's no longer attached to blood, therefore, your body will tell you that you need more oxygen. Therefore, you will be breathing more rapid, because the oxygen is not taking longer to the red blood cells so that they can be distributed across the tissues. Okay, this is what we call seething long deep inspirations, where you breathe for a longer period of time. There's also what we call stertorous, which is noise snoring inspirations with some kind of whistling, but whistle is on its own as well. Then we call the stridor, which is noise inspiration due to obstruction. This was noise inspirations, but this has a reason, due to obstruction of the upper airway passages. Then you also wheezing. Wheezing sound made during expirations, when you want to breathe out, and then there's that wheezing sound that is made. It can occur due maybe to obstruction of the nose, maybe there's accumulation of mucus. There's also what we call the chin stalks, a form of irregular but rhythmic breathing alternate periods of hypopnea and apnea. So it's more like irregular, but at the same time it's continuous kind of breathing. Okay, so you can be asked any of these, what is shallow respirations. It's maybe they can a wheezing sounds made during expiration, and then they want you to complete, and definitely that is wheezing. Or they can just say noise inspiration due to obstruction of the upper airway passages. This is called the strid. These questions can come on the fill in the blank spaces, even multiple choice. You also find some terms like dyspnea, which is labored breathing. There's also what we call orthopnea, which is difficulties in breathing, except when one is in a standing, or a sitting position. Take note of these definitions. There's also what we call apnea. This is the absence of respiration, cessation or absence of respiration, then we call that apnea. Then there's also what we call bradypnea, which is breathing more slowly than normal. Remember, we're talking about bradycardia in pulse, which is low pulse rate. So bradypnea, which is breathing more slowly than normal. Tachypnea, which is breathing faster than normal. Then there is hypopnea, which increase in depth of breathing, which may or may not be accompanied by an increase in respiration rate. So familiarize yourself with those terms. So how do you count the respiration? Of course, this is the important thing. Patient should be at rest. Allow any effect of exhaustion or excitement to subside, as it can increase the respiration rate. Remember, we look at those factors during exercise, when someone is excited, what. So you need to make sure that they are at rest. That's when you can get the respiration. The instance of being observed also changes the patient breaths. Therefore, count respiration without patient knowledge. So once you are observing the patient, the rising and falling of the chest, the patient can start overthinking, or they can try to act abnormal, like they can start to increase the breath. So you need to count the respirations without the patient knowledge. And how can you do this? When you are recording pulse, you are solely recording on, let's say maybe you are measuring blood pressure of the patient. Of course, you need to wait for these kind digital machines. You usually take blood pressure as you keep on waiting until it reads. So at that particular time, you can be observing the patient's rising and falling of the chest. Or when you are taking the pulse, that's when you can be taking two things at the same time. You are taking the pulse and also looking at the respiration of the what? Of the patient. That's how we actually get it without the patient knowledge. After counting pulse rate with fingers still on the patient's wrist, watch the rise and fall of the patient's chest and count for a minute. Okay, so this is what I was saying. After you are done with counting the pulse rate, then you now shift to the chest so that the patient doesn't know. In babies, you should watch the abdomen, assess the rate, rhythm, and depth. The depth is about how deep it is. Rhythm, is it regular or irregular? Then the rate as well. Then now let's go to the last one, which is blood pressure. So what is blood pressure? Blood pressure is very much important. The cardiovascular system, blood pressure is very much important. Therefore, as a nurse, it's very much important that you know the normal findings of blood pressure and the abnormal findings. What are some of the abnormal findings? How do you get the blood pressure? And how do you intervene in case where actually the blood pressure is higher than normal? Okay. So the blood pressure is the lateral force exerted by blood on the arterial walls. Okay, the force exerted by blood on the arterial walls. So when we mean blood pressure, we are talking at, it's not really away from the concept of a hose pipe. I always use this example because the most practical one. So when you are watering the garden, I don't know if you have watered the garden before, but of course you have an idea. When you are watering the garden, you are using a hose pipe. What will determine the pressure of that particular hose pipe is how small it is or how big it is and how much of the water is coming out. When water is little, even the small hose pipe, the pressure is not going to be enough. When water is too much, even when the hose pipe is big, but for as long as water is too much, it will still come with the pressure. So I'm talking about two things here. The amount of blood as well as which corresponds to amount of water, as well as the size of the lumen of the blood vessels, which corresponds to the hose pipe, determines the blood pressure. Okay, they need to agree with each other for blood pressure to be normal. So blood pressure depends on the force of ventricular contraction. So the force that exerted by the ventricles to pump blood out of the heart is also very much important because that's more like the water source and it will determine the volume of blood to be pumped out. You get it, ka? So it is measured in millimeters of mercury. The highest reading is obtained when the ventricles contract, and that we call systolic. The contraction of the ventricles is what is going to push blood out of the heart. So in case you are having issues in understanding the blood pressure, you should go in the playlist of cardiovascular system. You'll find a video related to blood pressure. You should watch that video. It's going to help you a lot. So the highest reading is obtained when the ventricles contract, which we call the systolic, and it's usually on top, and send more blood to the arteries, and the lowest diastolic when the ventricles relax. So the systolic is obtained when the ventricles are contracting, and the diastolic is obtained when the ventricles are relaxed. The diastolic mainly, some books say that diastolic is determined by the ability of the aorta to push that blood further, apart from the ventricles. Okay, and that happens when the ventricles relax and then the semilunar valves closes. That's when the aorta now adds its pressure to push that to push that blood, and that we call the diastolic. So what are some of the normal ranges? The normal range of systolic pressure is usually 110 to 130. This is the normal range of systolic. And diastolic is about 70 to 90. Okay. Some books will tell you 60 to 90 and it's not a problem. Okay. Even on the systolic, it will tell you about somewhere 90 to 120. So you should get all these measurements to be correct forms. Okay, these are just ranges. But now the normal blood pressure in adult should take it that it is 120 over this is slash 80 millimeters of mercury. This is the normal blood pressure. So you should take note of this normal blood pressure. The top figure, of course, I said is the systolic when the blood vessels are contracting, and the bottom figure is the diastolic when the ventricles are relaxing. So you find terms like what is the pulse pressure. So pulse pressure is the difference between systolic and diastolic pressure. In case they tell you to calculate the pulse pressure, just calculate the difference. Systolic, subtract diastolic from systolic, then that's the core pulse pressure. So blood pressure can be influenced by emotions, posture, age, as well as pathological changes. It's very much important you know that what influences the blood pressure. Some factors is venous return. What is venous return? Venous return is about the amount of blood that is going back to the heart. And usually we use the superior as well as inferior vena cava. So how much of amount of blood is returning to the right side of the heart? Then this we call the venous pressure, the venous return. When venous return is low, blood pressure is low. It's corresponding. It's more like it's a machine which is sending water. And it depends on how much of water returned so that it can also send that amount of water. And then look at this machine. This machine depends on the available water. I'm talking about the heart. There is fixed amount of blood in the heart. Okay? About 5 liters in females and 6 liters in males. And this is the only blood that the heart uses. So if it is sent to the tissues and then the venous return impedes, like it is obstructed, then a few is going to return to the heart, meaning that the heart is going to pump few to the rest of the body. That's what we mean by venous return. It's not like the heart produces its own blood. No, it uses the available blood in the body. Then we also what we call peripheral resistance. So this just refers to compliance with the ability of arterioles to expand. On the peripheral resistance, I can give you an example of a hose pipe which is having a smaller lumen. Okay? And it is having the strength. The tone is strong. So if elasticity is too much, then blood pressure is going to be low. But when the elasticity is strong, then you are going to have higher blood pressure. So in case of adults, those people are more likely, because they have lost the stin tag and elasticity is low, so they are more likely to have hypotensions. The blood pressure might be lower as compared to young adults. The greater the compliance of an artery, the more effectively it is able to expand, accommodate surge in blood flow without increasing the resistance of blood pressure. Okay, same as elasticity of blood vessel. I also described it when we were describing the peripheral resistance. So refer to capacity of resume of the blood vessel to resume its normal shape after stretching and compressing. If artery walls are rigid and able to expand, their resistance to blood flow would greatly increase, hence increase in blood pressure. Viscosity of blood is about thickness. How does thickness of blood influence the blood pressure? So as blood pressure increases in viscosity, even the blood pressure increases. Okay, so the more viscous the blood, the higher the blood pressure. Cardiac output. Cardiac output is the amount of blood that the heart is pumping per minute. Okay, that's the cardiac output. So cardiac output is direct proportional to blood pressure. The higher the cardiac output, the higher the blood pressure. If it is low, then we have lower cardiac blood pressure. So what do we use to measure the blood pressure? We use the what we call the sphygmomanometer. So the sphygmomanometer and the stethoscope, these are what we use to actually use to measure the blood pressure. But the sphygmomanometer is actually outdated. We are actually using something which is actually like a digital BP machines which have realized at this point. Okay, so this sphygmomanometer was in connection with the stethoscope. There's actually a better way of measuring this. I can't demonstrate it in this. Okay, unless otherwise I recorded a tutorial on how to use the sphygmomanometer with a stethoscope. So you just need to place a patient in a comfortable horizontal or sitting position with an arm flat and exposed. Then explain the procedure to the patient to prevent anxiety or excitement. Okay? Then expel air from the cuff and apply even on the upper arm so that the brachial artery can be palpated. After, attach the cuff to the sphygmomanometer and it should face the nest directly but tilted away from the patient. So these are some of the procedures where you locate the brachial pulse, you release the air slowly, remove the air completely and record BP. Yeah, usually this is how it's done. Okay. So basically, we have looked at all our vital signs. We have looked at the temperature. We have looked at blood pressure. We have looked at pulse. And we have looked at respiration. Okay? Respiration. So you should make sure that you pass through know the normal readings and some of the how to get it, where to get it, some terms. These are things that are asked on vital signs. Till now, I hope you enjoyed the video and it was helpful. Bye bye.